The fight, flight, freeze response is another concept that you need to understand before your upcoming labour. During labour, you may experience what is called the fight, flight, freeze response, which is a natural reaction to stress or perceived danger. This response is governed by your autonomic nervous system and involves the release of stress hormones like adrenaline to prepare your body to respond to a threat by either fighting, so running away, or freezing and doing nothing. So let me go through it in a bit more detail. Now, you may experience the fight response during your labour if you get agitated, restless, or you want to push back against the pain or your current situation. This fighting response can then lead to increased muscle tension in your body and in your birthing muscles and may interfere with your body's ability to relax and progress through labour comfortably and easily. The flight response involves a desire to escape or avoid the source of stress or pain. So in the context of labour, this means that you may want or even try to leave the birthing environment, or you may have a feeling of wanting to escape the pain and that you just can't do this anymore. This tends to happen in the final stages of labour. Some women actually do stand up and announce that they can't do this anymore and they just try and leave. This flight response is because of feelings of anxiety and panic. The freeze response is when you literally feel stuck or unable to move or make decisions during labour. This response can be associated with feelings of helplessness or being overwhelmed. When you freeze, the birthing process may slow down or even stop. It's important to note that the fight, flight, freeze response is a normal part of your body's stress response system and is not necessarily harmful during labour. However, what you're trying to avoid during labour is excessive or prolonged activation of the fight, flight, freeze response, which can then lead to increased tension, anxiety, and difficulty coping with your labour. Just like with the fear, tension, pain cycle, to help manage the fight, flight, freeze response during labour, you want to use your relaxation techniques, your breathing exercises, and other coping strategies to keep calm and reduce stress as well. And we'll be going through more of this in another video. Having a supportive birth team around you and a quiet, private, safe and dark birthing environment can help you feel safe and supported, which can then minimize the activation of your stress response system during your labour. So what you're trying to do with your hypnobirthing tools is to use them in a way that helps you stay calm and relaxed, focused on positive thoughts and aiming to not get caught up in the fear, tension, pain cycle or activating the fight, flight, freeze response.